You know that feeling when you've done everything by the book, checked all the boxes, but something still feels off? Well, that's exactly where a nursing student named Jane found herself. She was giving fantastic clinical care, but she had this nagging sense that she was failing her patient on a much deeper, more human level. So to figure out what was going on, we have to look at what she was worried about.
So Jane was taking care of a woman who had come from Sri Lanka. And look, she was on top of it. The medications were perfect, the nursing care was attentive, she followed every single procedure, but she just couldn't shake this fear, this idea that her care was somehow incomplete. She knew there was this whole other dimension to her patient's life, her culture, her spirit, that she just wasn't prepared to handle.
So what was she missing? It's a huge question, and it gets right to the heart of what great patient care really is. This wasn't about her medical skills or her knowledge of biology. No, it was about a totally different kind of understanding, a new way of approaching the person right there in front of her. It's an approach that has to go beyond just being competent.
To get to the answer, we've got to explore this really important shift in healthcare thinking, this move away from the idea of just competence and towards the practice of humility. And this isn't about memorizing more facts, it's about adopting a whole new mindset.
Okay, first things first. Let's make sure we're on the same page about what culture even means. It's not just about holidays or food. It's this whole web of shared beliefs, values, and behaviors that a group of people uses to understand the world. And for what we're talking about, it's absolutely crucial because it deeply, deeply shapes how people see health, sickness, and healing.
And that brings us to a super important distinction: the difference between a generalization and a stereotype. A generalization can actually be a useful starting point, right? Like knowing a certain group has a higher risk for a disease. But a stereotype? That's a harmful endpoint. It's an oversimplified idea that shuts down our curiosity and stops us from seeing the actual, unique person right in front of us. The goal is always to use knowledge, never assumptions.
For a long, long time, the main goal in healthcare was what we call cultural competence. Basically, the skill of interacting well with people from different backgrounds. And let's be clear, that is an incredibly important skill to have. It means learning about different customs and beliefs so you can give better care.
But here's the catch, with stopping at just competence. I mean, the world is unbelievably diverse. Trying to become a walking encyclopedia on every single culture is not just impossible, it kind of misses the whole point. It sets up the provider as the expert, when in reality there's only one person who's the true expert on the patient's life.
And this is the answer Jane was searching for: cultural humility. Look at how it's defined. It's not a finish line you cross, it's a lifelong process. It starts by looking in the mirror and reflecting on your own biases. It means acknowledging the power dynamic in a hospital room. And maybe most important of all, it sees the patient as the expert. It's a huge shift from saying, "I know about your culture," to asking, "Can you help me understand your experience?"
Okay, that sounds great, right? But what does it actually look like in a busy clinic or on a hospital floor? How do you take this big idea and actually put it into practice? Well, it all starts by breaking it down into a few key actions.
It really boils down to 5 core ideas. First, you have to start with self-awareness, just looking inward at your own assumptions. From there, you need an openness to learning, seeing every patient interaction as a chance to understand something new. And you do that through respectful communication, which really means asking open-ended questions and actually listening to the answers. And all of this has to be built on a non-judgmental attitude and a true collaborative partnership, where you and your patient are on the same team.
These steps are great, but you know what makes things really click? A good story. So let's take a look at a quick case study that shows how all these pieces come together to totally change a patient's experience for the better.
So let's meet Sarah, a nurse, and her patient, Mr. Patel. He was nervous, a little hesitant, and there were some pretty big language and cultural barriers. Now, instead of just plowing ahead, Sarah practiced cultural humility. She brought in an interpreter. She took the time to ask questions and learned that for him, having his family involved in decisions was non-negotiable. She didn't see these things as problems. She saw them as essential parts of his care. And the result? Trust was built. He was more involved in his own treatment, and he had a much better outcome.
Now, Sarah's story is incredible, but this whole idea is so much bigger than just one nurse and one patient. Practicing cultural humility is one of our most powerful tools for tackling a massive systemic problem in healthcare. It's about building a bridge across a really wide gap.
And that gap has a name: health disparities. And these aren't just random. They are real, measurable, and often preventable differences in health between different groups of people. What it boils down to is that your zip code can be more important than your genetic code.
and not everyone has a fair shot at living a healthy life.
So you have to ask, why do these disparities even exist? Well, they're tied directly to what we call the social determinants of health. This is the idea that our health isn't just about what we eat or if we exercise. It is profoundly shaped by the conditions around us, where we're born, where we live, and where we work. These are the things that often determine our health long before we ever step foot in a doctor's office.
And when all those factors come together, we see these real, documented differences in health risks. This table just shows a few examples. Now remember what we said earlier. This is a generalization, a starting point for understanding population health. It is not a stereotype to be applied to an individual. The critical thing to see here is that these aren't just statistics. They represent real people in real communities who are carrying an unequal burden of disease.
Okay, so understanding the problem is step one. But the next, most important question is, what can we actually do about it? And the good news is, change can happen at every single level, from one conversation between two people all the way up to major policy changes. Everyone has a part to play.
You can think about it in 3 layers. On the individual level, it's doing exactly what Nurse Sarah did: practice cultural humility, ask good questions, use interpreters. At the organizational level, it's about our hospitals and clinics creating more inclusive policies and offering better training. And then there's the policy level, which is about pushing for big changes that actually address those social determinants of health we were just talking about. Each level supports the others.
So where do you start with all this? It's not with a textbook. It's not with a weekend seminar. This is a lifelong journey, and it begins with one simple but incredibly challenging, self-reflective question. A question that really gets to the core of what cultural humility is all about. Am I aware of my own biases? The honest process of answering that question, that's where the real work begins.